T-Bone and Heather in the morning on Star 98.3 and 97.7 The Bay.
Yes, sirree. 8 minutes after 8 o'clock, 8:08. We got Dr. Polsky on the line with us this morning. Hello, sir. How are you? And welcome to the show.
Good morning. We're doing great over at the health department. How are the two of you?
Fantastic. I'm excited. I'm buoyed by the good news from good old Dr. Fauci that this remdesivir showed some positive results, and that's greght news.
Well, regardless of whether somebody swapped out Dr. Fauci's prune juice and slipped in some Kool-Aid,
right?
I actually had some other good news, and then maybe we'll go back.
It's a good news avalanche.
Are you kidding? That's awesome. What do you have?
So I mentioned last week that we were starting to see what looked like a bit of a decline in cases over here, but it was a little bit too early to really go any further.
Mm-hmm.
Right.
Over the last 2 weeks, we have averaged 3 positive cases a day. And that's compared to the 2 weeks previous, where we were seeing 8 to 10 cases.
Wow! Well, that's huge.
That is really great to see. And in addition to that, although I just heard them report 8 deaths in Calvert, that's not really the case. And we've had 2 deaths in Calvert. The state misattributes people who are living in nursing homes outside of the county, but at one point lived in a county.
Oh.
So of those 8 that are attributed to Calvert, 6 of those occurred in nursing homes outside of our county.
All right.
And both in St. Mary's and Calvert, there's been a total of 1 resident in a nursing home who has died. So not that we want to trivialize that.
No.
But it's important when you're trying to keep numbers accurate and find out what's going on. I mean,
is the state going to fix that? Is anybody talking to the state about,
we have talked to them, and it's a complex web.
Sure.
Yeah.
They're done.
I bet it is.
I know of what you speak.
Okay, so go ahead.
But the reason I wanted to bring that up is that I think overall that we're doing a really good job down in the southern counties compared to, say, Anne Arundel, and I don't want to call them out particularly.
Right.
But when you look per capita, there's over twice as many cases in as you go further north than the southern Maryland counties. And with all the attention on nursing homes, we've actually been doing a really good job down here. So I'm hoping that if there is a phased-in approach to lifting some of the restrictions, that maybe the southern Maryland counties might be toward the top of the list to start to phase, I don't think things are going to be back to normal per se.
Sure, right. But
to start to allow some things that we haven't been able to do over the last month or two.
Let me ask you this. In Arundel County, since they have more cases, could that be because they have better testing, more testing?
Well, that is a possibility. And so it's been difficult to interpret some of the statistics. Now, I don't want to call out Anne Arundel specifically.
Sure.
But when you take a look and to see where the bulk of the cases they've been in areas where there's a denser population, and so again we'll see what the next month brings. But I certainly see some rays of hope that, especially in the more rural counties, that we'll be able to start to then be a little bit more permissive to allow businesses and other activities to start to return.
I got to tell you this, since all this started, and I can really graph it, I guess, but this is the first day where I've been like, okay, now we're getting a toehold here. Now things are coming together. So I am excited. I am jacked about all of this news that is coming out today, and I think good things are in our future.
But Dr. Polsky, I want to ask you a question, and it's one that T and I keep arguing about, and that is, and I know you've explained it to us before, but if you could just take a moment and do it again, because it seems to be in the forefront of discussion when when we talk about opening states and trying to get back businesses back and things like that. If you had COVID-19, okay, and you're tested, you have the antibodies, what are the chances of you getting it again? Because I have heard I've heard different information on both. Some people are saying you're not going to get it again. You are immunity. That's what we're.
I believe that it's incredibly low. Am I right?
But you're not a doctor. Hello, Dr.
I've
Polsky.
talked to one.
What are the chances of us getting, or do we not even know that yet?
Well, the reason you're hearing different responses is that we don't have a definitive answer to the question. However, for people who have been truly symptomatic, it's not a question of, well, maybe I was sick, maybe I wasn't.
Right.
Mm-hmm.
And they have an immune system that functions reasonably well. So that's 90-some% of the population. That every expectation based on other viruses that we've dealt with for decades and decades would be that those people should have a decent amount of immunity, whether that will last a year or two, whether that will last 5 or 10 years, that we don't know. But it would be extremely unlikely that people in those circumstances would end up getting reinfected over the next year or two.
Okay.
What we don't know at this point is for people who have not displayed any symptoms, what does it mean for them if they get re-exposed? So it's reasonable to say, again, for people that have a decent immune system, that they will have a good degree of protection, but we just don't have the evidence to say definitively.
Okay. So, yeah, we'll know when we know, but moving forward based on everything we know about viruses, and this isn't our first rodeo when it comes to viruses, they should have a pretty good degree of immunity, at least in the short term.
And I just am asking you, just as a doctor, just personally what you think. And I know that there are doctors out there with different opinions, and we've actually talked to you about that. What does reopening the state of Maryland look like to you?
Oh, well, so first off, that's not a decision that's up to me.
Well, I know, but as a doctor, with the county health department, what does it look like?
Yeah, I as I mentioned, that we've been doing a good job down locally, and I think that there has been a pretty good amount of personal responsibility, both on the part of store managers and on the part of customers coming in. I've seen people wearing face masks consistently. We have, and we know because we're out there with our environmental health people in the stores on a regular basis, that they're cleaning carts, they're using proper disinfectants. So part of this is going to be how the density of people getting together, which changes the potential for disease transmission, obviously, and also for just reasonable hygiene. I think that the big questions are going to be how are the schools going to be handled?
Right.
And then what are the potentials for those children as they come in contact with older relatives? And I think that'll be the shift in discussion as we get into summer and into fall.
So do you think, well, you can't make this decision either, but what does it look like for schools in Maryland, especially down here in our neck of the woods? I mean, do you think that they will change that and maybe by the 17th, 18th, schools will reopen?
I have absolutely no
No.
information.
That's not in your wheel. You got
It's
other things
okay.
going on.
I tried to get you.
Yeah.
It's okay. It's gotcha journalism. I tried to get you to answer, but that's all right.
That's fine. In medical school, they don't teach us that.
Yeah.
All right.
Well, all right. You're out there fighting the good fight, and there's a little bit. There's a glimmer of hope now as
Thank
things
you
move
for the
forward.
Good news. Yes, we had good news this morning.
And you mentioned about potentially more testing in places like Anne Arundel, Prince George's, and Montgomery. So we did, on Tuesday, we did open up our drive-through testing in Prince Frederick, and everything went extremely smoothly. We'll test about 100 people this week. Next week, we'll increase to 120, and then if there is demand, we will continue to increase the number of people that we're screening each week.
So I'm a little unclear on one thing when it comes to the testing, and maybe you can shed some light on it. So I hear about testing. What does it take for a person to get a test? I mean, let's say there's somebody listening right now and they say to themselves, well, I'm feeling a little punky. I'd like to get it. Do they need a note from their doctor? Can they just drop by? What is the process?
They need a little bit more than a note from the doctor. They need an order, just like you would for any, like a cholesterol test or a test for blood sugar. So they would need to get in contact with their doctor, and that could be done via a telehealth or an in-person visit.
What if they don't have a primary caregiver? What if there's someone who, just doesn't have one? What do they do?
So for people who are in Calvert, at least, and I can't speak for other counties, but both the hospital system and also Calvert Internal Medicine and the urgent cares are open to take new patients at this point.
All right.
And information, you can find that either on the health department's website or Calvert Hospital's website as far as phone numbers to contact.
Okay, so they get the order from the doctor. They show up at one of these places, and I'm sure there's a website where they can see.
Is it the antibody test, or is it a test that says, yes, you do have it? Are they different tests?
It's a test for the virus itself, not for
Okay.
antibodies.
Okay,
And,
all right.
And what they'll do is once their doctor puts the order into the computer system, then the patient, him or herself, will actually book the appointment online. And so they'll have a specific date and time, and then they'll show up. It's very easy once they get there. They stay in their car, drive up, roll their window down, swab, and then they just drive off. And then the expectation is within 2 to 3 days we'll have results back.
Are you guys
Great.
doing testing now for the antibodies, or is that farther down the road?
That's farther down the road. And,
Okay.
and that's something that, and I'm sure you've heard a lot on the news, questions of how reliable those antibody tests are.
Yeah, I have heard that, yes. So,
All right. Well, listen, I appreciate you calling in today. It's always good to touch base. And
great that you had good news this
you
morning.
had good news. Fauci had good news. It's like Christmas.
And I just want to add that although I'm very happy to hear that there is one trial at this point that is showing some incremental benefit,
Don't you rain on it.
the important thing is over this next month or two, that medication is not going to dig us out of this hole. That medication is hopefully showing that there's a path forward when we get into fall and winter.
Okay. All I'm hearing is we're out of this. So, okay.
But
All right.
now it's keep up what everybody's doing right now, which is to minimize the spread. Because again, over this next month, we want to lift these restrictions, and we need people to continue
Right.
to essentially, be good, responsible neighbors.
All righty.
right, awesome.
Thank you, sir.
Thank you, doctor.
Thank you.
Have a great weekend.
Thank you. You too.
All right,
Bye.
bye-bye.
That's all I'm
Don't
saying.
you rain on it.
Don't do it. Don't you do it. I mean, we got one. We got a win. Let's just go with the win, man.
That was awesome.
We got a win.
Don't you rain on it.
Don't you do it, man. Do not do it.
One of these days, you're going to get him to laugh. One of
I
these
don't think
days,
so.
you're going to get him to
I
break
don't.
and laugh.
I think they beat that out of you in like medical school. They this.
No. I've met a lot of doctors with excellent senses of humor. So, and I think he has a really good one, but I think he plays it very well on the air, professional. But you'll get him. Sooner or later, you'll get him.